Welcome to AETCM, the Emergency Medicine Channel. Today we are going to talk about a case of scorpion bite. Scorpion sting.
Okay.
A 68-year-old male
Okay.
presented to here with complaints of a scorpion sting 1 hour ago. Sir.
Okay.
Right now on initial 10-second assessment, patient is oriented and conscious oriented and talking in full sentences. So we continued with our primary survey. On airway, patient was talking in full sentences. There is airway is patent. Next, coming to breathing, patient is having respiratory of 22 per minute and saturation was 99% at room air. There was no any added breath sounds. Normal vascular breath sounds are auscultated. In circulation, patient was having heart rate around 99 per minute with BP of 210 by 130.
Okay.
The blood pressure is at this point we put in IV cannula. We have taken the blood samples.
Okay.
At the same
What blood sample you want to take?
PT and PT and to be taken care of at this time. And at the same time, coming next to at this point the BP was the high. Next, coming to the disability patient.
What you did for the BP? That's the first thing. No, you have a problem. You have to sort that problem. No?
Patient is actually complaining of the pain of severity score of 8 by 10.
Okay.
So at this point of the sting bite. So in view that the pain might be causing the increase in the BP, we had given the pain medication.
Okay. So we have a 67-year-old gentleman who has come with 1 hour back. History of scorpion sting over his left foot.
Yes, sir.
Left foot.
Left
right
foot.
now, he's hemodynamically, BP is around 210 over 110, and there is no evidence of pulmonary edema. So that's the one of the issue that you can have following a scorpion sting. And later on, you went ahead and you thought that it is due to pain. Why you say the hypertension is due to pain? It is not due to the scorpion sting.
As there is a reversible factor of pain initially.
No. Why can't it? Why you are not saying it is not due to the hypertension? Is not part of your scorpion sting.
Ideally, hypertension is a feature of the scorpion sting, but I mean,
So hypertension is a feature of scorpion sting, no?
Yes.
So you can not just because of pain you cannot have 210 or 110 blood pressure. That is also attributing. That also is one of the reason for your hypertension. So you just don't take it for granted that it is due to the pain that the blood pressure is on the higher side. So now you treated the pain with what?
First we have given IV paracetamol of 1 gram.
IV paracetamol of 1 gram.
Then coming on reassessment of the primary survey, the pain was reduced. The pain score was still 7 by 10. The pain wasn't reducing, and the BP was still 210 by 130. So at this point of time, we hiked up the pain medication as well as the ideal agent of choice for the scorpion bite in the initial hours would be prazosin, which is the alpha antagonist.
Okay.
As there is the patient having the primary symptoms of hypertension.
Okay.
We had started with the prazosin.
Okay. So just we'll have a quick overview of basically we have a patient with scorpion sting. What are the symptoms that you anticipate in this patient? How can you classify the symptoms
In the first
following? You can have local and you can have systemic symptoms. So local symptoms versus systemic. Can you tell the local symptom? The most common will be pain at the bite side, significant pain at the bite side. And one more thing is that sometimes the patient will come with some unknown bite. They doesn't know that it is scorpion. And how can you differentiate it between whether it is a scorpion or something else?
Initially, the examination of the bite side to see if the sting is still in place or not.
You won't see any sting. That's very difficult. Wasp and all you might be able to see. But one of the most important thing in scorpion is that one is called a stab sign. You just tap over the bite side. The patient will have excruciating pain. So that is one thing that is very much suggestive of it can be due to a scorpion sting. So just tap over wherever the patient is complaining. Just give a small tap and see if the patient is having increase in pain. So if that is there, then you can say that okay, it is a scorpion sting. So that is regarding your local symptom. Now coming to your systemic symptoms. What are the possibilities of systemic symptoms?
Initially, there can be primary symptoms like hypertension.
So you divide them into sympathetic and parasympathetic symptoms. So sympathetic you'll have
system would be tachycardia, hypertension, sweating, and even insulin depletion. and also angiotensin, increase in the angiotensin causing the hypertension.
So everything increases. So that is one thing. Sympathetic overdrive. You have an adrenergic storm sort of a thing. Sudden gush of an adrenaline has happened. Suddenly you are seeing a snake. What will happen? You will have that. What is the fear?
Fear and flight.
Fear and fright will automatically will develop. Similarly, you will have an adrenaline surge in your body. You can have flash pulmonary edema. So that is one thing. Because of the hypertension, the patient can go into flash pulmonary edema. And later on, the next phase is that they can go even for a shock, cardiogenic shock also. You can have hypotension also. It's not just hypertension. They can have hypotension also. So it can be bradycardia, hypertension, it can be tachycardia, hypotension, all those things can happen in a scorpion envenomation or a scorpion sting. So next will be the parasympathetic. Parasympathetic will be, what are the other?
Bradycardia and
Bradycardia, urination, then increased secretions and all those things you can have as a part of your parasympathetic activity also. So these are the cluster of symptoms that you need to remember. So when a patient is coming to the ED with a background history, especially in Kerala, it is not very common to see the scorpion. The red scorpion is not very common. What we see is commonly the black one. There are two varieties. I don't exactly remember their scientific names. So the Indian red scorpion and the black scorpion, these are the two one. But the most venomous one will be the red scorpion, which is most potentially seen in Pune, Maharashtra, Tamil Nadu, Orissa. These areas are very notorious to cause this red scorpion envenomation. And what is the major issue that it can cause is sudden adrenergic rush, and the patient can suddenly collapse and they can even go into a cardiac arrest. So in that situation, how you should be approaching the regarding the anti-snake venom, the anti-scorpion envenomation venom availability is not that freely available. That is why Dr. Bhavaskar has come up with an idea. You can just treat with prazosin alone. Nothing needed to be given. You need not give any anti-scorpion venom. So even if it is not available, prazosin is easily available. You can just treat with prazosin, which is an alpha blocker. So how will you, for this patient, how will you start prazosin?
We usually start 30 microgram per kg.
Okay.
That would roughly, if you consider the weight of the person, 61.8 mg.
Okay.
Prazosin is available as 1 mg or 2 mg tablets. In scorpion bite, we shouldn't give a sustained release. We need to give immediate the full dose tablets.
Full dose tablets, yeah.
Usually 2 mg to 5 mg of prazosin
might be required. Initially you can start with 1 mg, then depending upon the patient's symptoms, you can just after 30 minutes you can reassess the patient, and every 3 hours you might need to continue the prazosin. So that is the importance of prazosin. Even with prazosin, you will be able to manage the adrenergic surge and all the pulmonary edema you will be able to manage. Can you give morphine?
Morphine is avoided in this because there can be chance of dysarrhythmia along with the prazosin.
Along with prazosin and already with the toxins, tachycardia, there is a possibility. So classically when you treat pulmonary edema, we will give morphine, but it's what in here it is not indicated. It is actually contraindicated to give morphine in case of a scorpion envenomation. Now coming to the next thing is the pain management, which is the most important thing. How will you manage?
Side. Initially, we can start with IV IV analgesics.
IV paracetamol.
And further, but ideal choices would be applying local anesthesia.
It is applying local anesthesia, not local analgesics, local anesthesia. You can give xylocaine. You can take without adrenaline. And you can infiltrate it around the wound so that the patient will have that blocking effect and the patient will be relieved of the pain. So that is one thing. Maybe once or twice you can give the block. The patient will be symptom free. So when a patient has come to ED with scorpion sting, our priority is to pain management is the one. Next, the patient is going for an autonomic dysfunction sort of a thing. They can go into pulmonary edema. The prazosin is the major antidote. And if they are going into cardiogenic shock, you need to manage it accordingly by giving adequate fluid and dovitamin also. Then
there are stages of the
4 stages. Can you explain that?
In the stage 1, we see the primary symptoms of sweating, salivation, and in males, we can even see priapism also, hypertension or hypotension. In this phase, the adrenergic or the cholinergic system is not activated. In this is just the primary symptoms. In stage 2, it is mainly the adrenergic, where there will be hypertension and tachycardia. And in stage 3, it will develop cholinergic symptoms will be taking over, and there will be hypotension and some sort of pulmonary edema will be developing. Stage 4 will be the
cardiogenic shock,
massive pulmonary edema and the cardiogenic shock. And stage 5, we can see further if there is a tachycardia, hypotension, pulmonary edema, and post-shock.
Yeah, there is an what is regarding the anti-scorpion venom. It is available, but it's not very freely available. There is two brands that is available. One is for our Indian scorpion, and another one is for the African scorpion. So that is what been manufactured. So when we had a patient, we just inquired regarding that, but we have never given anti-scorpion venom for any of this patient. They just recovered with prazosin. But if it is available, you can try giving that. Around 3 vials, you need to give it as an IV infusion over 30 minutes. So that is a recommendation for giving your anti-scorpion venom to the patient. But routinely, even if with individual prazosin, you can manage the patient. 1 mg of prazosin, you can give cumulative doses depending upon how the patient is improving.
Then regarding the management, like any management, we start with the ABCDE, and in this also, if the patient is going into hypotension, we can start resuscitation with primarily with the fluids, 30 ml per kg. We can start, and if the patient is in the hypertension, we can start with diuretics, and also if the patient develops breathing difficulty, to start with NIV. Post intubation. And here, as the patient will have the cardiogenic shock because of the heart tissue which is getting affected, our treatment of inopressor would be the dobutamine.
Okay. And one more thing, in pediatric age groups, they are getting envenomation, they will deteriorate much faster because their body surface area is very small. So the amount of venom, and it can be very, they can deteriorate very fast. You said regarding PTINR, why you want to send PTINR?
To check for him.
Hemorrhage or thrombosis, it will occur. It will be more of thrombosis. More of thrombosis it can occur, and it can have microthrombi formation, and the patient can develop stroke or maybe an acute myocardial infarction also. There is direct toxin mediated cardiotoxicity also there, but microthrombin formation also can happen. Hematological manifestation like thrombin formation can also happen to some amount of some patients with scorpion envenomation. So just like in our snake envenomation, but in snake bite, hematoxic snake bite, we'll see more of bleeding manifestation and less of microthrombi, but both in DIC, as you say, both can happen. So that's one of the other thing that we need to see.
And
so
one of the rare complications would be anaphylaxis to the sting.
Anaphylaxis to the bite, the protein. It is basically all protein has been injected. So directly due to that, you can have anaphylaxis. Okay. Anything else that you need to add on? So basically, whenever you see a patient with scorpion bite, when will you suspect? First thing, you need to suspect whether it's a scorpion. An unknown bite can come. It can be a snake bite or any unknown bite. You need to observe the patient for 24 hours. That's the first thing. All the patient need to be observed, and they need to be going through all the routine coagulation profile. So whether it's a hemotoxic envenomation or whether it is a scorpion sting, we need to observe the patient. And one thing that is suggestive of that, okay, it can be a scorpion sting, is that one is the tap sign. So tapping over the bite side, if you got any pain, you can think that it is a possibility of a scorpion, and it can be any other wasp or anything other sting. As you said, you need to look in for the sting. Anything is there, you need to remove that. Till that time, the patient might have anaphylaxis also. So that is the initial part. And next thing, specifically for the scorpion envenomation, you have got, as you said, different phases. You can have sympathetic and parasympathetic symptoms. You can have hypertension, bradycardia, tachycardia, sweating, patient going to pulmonary edema. All those things can happen. But basically, our treatment option, the treatment that we can say it as an antidote, is prazosin. You just say that antidote for scorpion envenomation maybe is prazosin. You need to give around 1 mg for an adult patient, and you can repeat the dose depending upon the response that is required. And always keep a possibility of a microthrombin formation also in this group of patient. And pain management, very key. Paracetamol is the drug of choice, and also you can infiltrate xylocaine around the bite site also.
In this case, the patient pain wasn't reducing, and when we had given the local anesthesia, he had reduced pain, and the second dose of prazosin had reduced the the BP of the patient.
Okay.
And we discharged clinically after 1 day.
Okay, fine. Okay. Thank you.